Thank you, Ken. That was fascinating. I took a lot of notes. All right, well, good morning. Good morning. I'm pleased to welcome you to day 2. I'm David Eisenman. I'm a professor at UCLA in the School of Medicine and School of Public Health, where I also direct the Center for Public Health and Disasters. So today, the content of these sessions, we begin with the end in mind. We're trying something different here. We often think of disasters in the disaster field as having a very classic, simple temporal cycle. We start with preparing and preventing and mitigating before a hazard hits, and then a hazard hits where people live, without which there wouldn't be a disaster if we didn't live in that spot, at least classically. We're thinking otherwise now that we've talked about smoke in a different way. And then we respond and we recover. And there's a classic cycle that we teach our students about this. But more and more, when we're recovering, the next disaster hits. And so you get this kind of overlay and asynchrony of a cycle within a cycle. So we think to ourselves now, as more and more disasters can hit at the same time. In California, we can have drought, followed by heat wave, followed by forest fires, followed by mudslides, all happening within the same region or even same communities, multiple complex events. Think of Hurricane Katrina followed by the BP oil spill. That's the historical example the United States had. We will see more of that. So what can we do now that this is the new normal, or as our former Governor Jerry Brown said, the new abnormal in 2018 regarding the 2018 fires? We can start with the end in mind. We can start with the recovery. The recovery that goes on for years, is multi-sectoral, resource intensive, all-consuming, borne by the local communities for years after. And that's something we need to emphasize here. So the wildfires spike in acute trauma and acute terror gives way to a long tail of recovery. But actually, in this field of disasters, recovery is often not the focus of our conversations. Not surprisingly, the national camera crews have gone home. The researchers have gone back to their institutions. It's not visible, and it's not front of mind anymore. So this may be one reason why, at least in the research literature, there's so little of it on the health and human aspects of recovery from disasters generally and wildfires specifically, despite its long duration and huge impact on well-being. But I suspect that the narrative structure of our meetings doesn't help either. Recovery may feel like an afterthought if we structure the meetings along the classical timeline, discussing recovery at the end of the day. The keynote speaker has finished, people are tired, they're rushing to catch their airplanes home. So today we start with recovery in mind. We harness your well-caffeinated, well-rested morning energy to focus on this topic. And we hope that we can do so that you can think about how all the other phases can also help to improve our ability to ameliorate and prevent the suffering that goes on. So I'm going to provide a brief intro to our speakers, have them come up. The longer bios are in the handout, or in the program, of course. We're first, why don't our speakers come up? But our first speaker is coming in remotely. Byron Mason is Deputy Director of the Office of Human Services, Emergency Preparedness and Response in the Administration for Children and Families in the Department of Health and Human Services. We will then hear from Annie Schmidt, who is the Director of Policy and Partnerships for the Washington State Fire Adapted Communities Learning Network, as well as the Public Affairs Officer for Keelan County Fire District 3 in Leavenworth, Washington. Megan Kurtz will follow. She is a lecturer at California State University, Chico, in Recreation, Hospitality, and Parks Management, and is the Wildcats Rise Community Liaison, in which capacity she's been representing Cal State Chico to the Board of Directors of the Campfire Long-Term Recovery Group. As with yesterday, our speakers will speak for about 15 or so minutes, and we'll follow that with questions and comments from the audience. So I now turn us over to Byron Mason, who I hope is on the line. Byron, are you there?